Hello, Dr. Besso here. So we have Mary that's going to share her success story with BRP, and she'll explain a lot more about that. So thank you for sharing and just for your heart to encourage others. So I guess first just describe what you're feeling, like what BRP is and how it affected you. And
BRP is short for Brachioradial Pruritus, if I'm saying it right, which
Yep.
is basically itchy arms, which
Yep.
I've had for over 30 years.
Wow.
And I don't know why, but it comes on in like August usually, and then it subsides in like January or February. So it's an intense itching that causes me not to be able to sleep or
Yeah.
really function very well.
And so I think it's most of the time it's sort of,
It's from here to the shoulder.
oh, for you it's from here to here.
Yeah,
Okay, some
yeah.
people I have that it's down here. So it's like
Right.
this part of your arms just sensationally itchy, which is not a good feeling. I can't
Mhm.
I know I had poison ivy before, and
Oh yeah.
you have that for just a few days and it's uncomfortable. I can't imagine
Yes.
having this for months
Right.
and having it not go away. And
Yes.
so then what types of things just generally had you done for it over the years?
Well, ice is the number one thing that will stop the itching.
Okay.
So sleeping with ice packs is.
So while it's cold, it's helping.
Yes,
Okay.
the cold helps, and that's like the only thing that helps. But as far as treatments go, I have tried regular chiropractic care, different kind of ointments, massage, TENS units, elimination diets with a functional medicine.
Yeah.
So I figure that all in, I'm about $30,000
Wow. Okay.
in trying to treat this.
Right. So you're trying to treat it, and that's a key word because a lot of times in like healthcare, they're treating a symptom, and right. And sometimes, especially something like a topical analgesic, you're just trying to make yourself feel better temporarily, which feeling better is good, but you'd rather fix the cause. And so it's sort of interesting. So then you found out about the upper cervical care and how that can help. Is that right? So then you started care early in the year. So now just for perspective, so it's end of October. So you started early in the year, but you don't normally get symptoms till August.
Right.
And so what happened since then? So August, September.
Yeah,
October.
so normally by now I am in the middle of it with full-blown horribleness.
Wow.
And I've had no itching, none to mention.
Wow. Wow. That's awesome.
This is the first time in 30 years.
That's awesome. So
It is
that's really
awesome.
cool. So we've done our upper cervical care. We have worked on a couple other areas, and then we actually did laser treatments too. The Zirconia laser, but I think the main thing is the upper cervical. And for me to say exactly how I know that's helping, I don't. I'm very frank about that. I'm not sure if when we're realigning things, if we're affecting the brain processing of the pain, the perception of the pain, or if we're actually affecting the nerves that go down to that area of the arm. I'm really not sure, because each case I've seen is a little different, as far as how much, if there's disc problems and degeneration and so on. And then you are just super excited to share this.
Super excited. Every night I go to bed and I can sleep on either side of my arms. I normally would have to sleep like this with ice packs on. And
wow.
So, and I sleep all night.
Yeah. And you've been sharing this with others. You've actually sent a couple other people in that have this condition, and I just appreciate your heart to help others with that. And so, but thank you for sharing and for your story, and hope it encourages other people. Yeah. You're welcome.